Good evening, welcome. I'm Ellen Teeter, the Executive Director of the Florida State Oriental Medical Association, and we're here with David Bibbey, who's going to be giving a legislative update. A lot of things going on. Welcome, David. There you go.
Got me now, right? I'm unmuted. Thank you, Ellen. Good evening. How are you?
Good, I'm good. We've got some people online.
Yeah.
If people want to ask questions, you can put them in the chat or the Q&A, and I'll keep an eye on that for you, David.
Thank you.
Why doesn't everybody put in what city you're from or what legislative district, if you know? Hey, John, same as me, Bradenton. DeLand. Miami. All right, Valrico. Jacksonville. Melbourne. Right. Well, I know you have an update for us, David, so.
Right. It's just about 4 past the hour. Do you want to give another minute or so, or do you think we're ready to begin?
No, I think we can go ahead and start. It's recording. So we'll be able to, if people feel like they've missed something, if they jump on.
Sounds good. Well, I want to thank everybody for joining tonight. Thank Ellen for hosting. I wanted to provide a quick update and opportunity for anybody to ask questions. And since this is recorded and going to be sent out to the membership and elsewhere for everybody to view, I'll just start with some brief comments that bring us up to speed with the changes and things that we've seen with House Bill 583 in particular. The reason I say that is the Senate version of this bill, Senate 230, has already been through committee, and it's resting in messages on the Senate legislative side to be paired with any language that comes out of House Bill 583. And ultimately, those two versions of the bill will be combined to come up with a final version of the bill. But we've been updating you on the House Bill 583, the professional titles and abbreviations bill in the House, sponsored by Dr. Ralph Mazzullo. He's a representative from my area. He has several co-sponsors, but Dr. Mazzullo has been running point on the bill. And on the House side, it had originally 3 committees of concern, and it moved through the Health Regulation Subcommittee last week and was voted upon and approved. And from there, it was intended to go to the House Appropriations Subcommittee, but because of the schedule in the House and because of the number of healthcare bills that are being evaluated this year, everything in the healthcare track is being is going to bypass appropriations unless there's a financial expense to a municipality that the state needs to vote on, or a municipality or state budget. That does not apply to the bill at hand. So it's going to, its next committee of concern is the large Health and Human Services Committee in the House. Chairman Randy Fine and his staff and the full committee is expected to hear that bill. They met on Monday, this past week, yesterday, and House Bill 583 was not on the agenda, so it was not heard or discussed, which is favorable for us because it still buys us additional time and opportunity to continue to work with the chairman and the leadership and the sponsor on potential language for acupuncture titling to be included in the bill. And the reason why it's important is because the changes that are being discussed don't affect Chapter 457, which is the local practice act for acupuncturists under Florida law. This is an amendment to the General Healthcare Occupations Statute 456, which we're also responsible for complying with. And from a legal standpoint, we're regulated as acupuncturists under the General Occupations Standard, the Practice Act under 456, and under the rules that are part of 64B1. And so we're accountable to all of those statutes and rules in terms of providing context and regulations for the practice of acupuncture. The bill at hand, the House bill, is designed to alter definitions and some terminology in the General Occupations Statute, which would have a carry-on effect to acupuncturists. And the reason why we're fighting so hard for an amendment is that we're looking for some explicit access and permission to continue using our professional titles that include the word doctor and include the word physician, because the bill at hand seeks to redefine how those terms, both doctor and physician, are used alone or in combination with other words. And so to give some context to that, doctor is modified in our practice as doctor of acupuncture, doctor of acupuncture and Oriental medicine. It's not used as a standalone term. It's used in combination with other words to modify or define the type of medicine that we practice. The same thing applies to the word physician. By using acupuncture physician, we're clearly defining the area of practice and the specialty of practice is related to acupuncture. But the definitions that they're seeking to redefine would eliminate the possibility that we could use one or both of those titles. And so I want to thank everybody for being so responsive and heeding our call and instruction, because I've get lots of feedback all day long from colleagues, both members and non-members, working to communicate with their district representatives, to share our messaging and our desire for an amendment to this bill that it specifically includes acupuncturists so that these titles are being protected for us. I do have, as part of update, something that's very important and to this process and important to know. After the last strike all, a strike all is a term that they use when bills are moving through committee. If it's going to be amended or edited, they'll use the term strike all to say that the previous version is being eliminated in place of a new version of that bill. Well, the bill as it passed in the Health Regulatory Subcommittee had a strike all which removed the prohibition on the word doctor, which is a big coup from our perspective and for our purposes, because it releases any prohibition around the use of the word doctor alone or in combination with other modifying terms like acupuncture and Oriental medicine, and it frees up those titles. I would also caution, though, everybody, that unfortunately 457, our own Practice Act, does not make explicit definition or use of that terminology. And it is something that we need to be mindful of, and it's something that we need to be working toward fixing as soon as possible, because permissions around titling are largely granted through the advertising rule by the board of acupuncture. So we still have work to do. We want to retain access and use to the word physician in our titling. It's important because it is a historical norm here in Florida. It's well understood and respected around the country. The Department of Labor considers it one of the common and usual titles for our profession. And since we're working on changes to the Medicare standard to include acupuncturists as standalone providers in the physician section of the Social Security Act, we certainly don't want to lose any ground around titling and use of the word physician as part of our profession. So that's my update. And I want to say that, you know, the bill, House Bill 583, is going to remain in the Health and Human Services Committee until it's heard. Right now, that committee is not scheduled to meet again yet. They've just met yesterday. It's likely that they'll meet weekly until the end of the session. So I wanted to just let everybody know that we're mindful of the House schedule, and when the meeting is planned and the agenda is produced, FSOMA will share that information with everybody, okay? In the meantime, continue with your emails, continue with your calls. If there's anybody on the Health and Human Services Committee that you haven't had a chance to, that's on our contact list that you haven't had a chance to speak with or communicate with, continue to do that, and just let them know that acupuncturists are still looking for an amendment for House Bill 583 to include our professional titles. I'm open to questions, and Ellen, if there's anything in the chat that you want to share with me, I'm happy to do that.
I have a question. Our current talking points have a list to, it just says HHS committee. Is that's the House Health?
That's the House Health and Human Services Committee.
So that's
HHS.
the one. Okay. So our current links on the website have that information.
Yeah, all the contact lists have been updated for the committee members, and the talking points are accurate. You know, the simple thing that we're saying is that we're asking for an amendment to 583, and if an amendment can't be had, then we want a no vote. You know what I mean? And so obviously the opposite is true. If there's an amendment, then we want to support that. There's no need for a no vote as long as acupuncturists are included in the titling exemptions.
Right now, I'm just gonna, for some reason, my screen sharing is paused. I'm not sure why.
I'm going to step away just for 2 seconds, and
okay.
I apologize.
I do have okay, I'll have a question when you come back. I'm trying to figure out why my screen sharing is not happening, guys. Basically, you go to FSOMA, FSOMA.org home, and click on the legislation, and you'll get to the current talking points and the current committee information. So, David, have you or anyone followed up with Representative Edmonds, whose assistant asked if we have any specific amendment language?
We do have specific language, and we were in touch with Representative Edmonds' office, and I've connected him with Corinne Mixon, our lobbyist. And so again, it's important for everybody here, especially, you know, our advocacy and our advocates and everybody that's pressing for commitments from the representatives, that has to be filtered through our government affairs and lobbyists and attorneys. At no point do we have, you know, raw language to share with any particular representative. The reason for that is, you know, a little bit of due process. You know, a bill is sponsored by a representative or a senator, and it is their bill. They're really the only people that, under normal circumstances and under most circumstances, that's going to admit a language change to their own bill. And so the proper way for us to manage that is to continue working with the sponsor, and we are. And the next best option for that is to work with the chairman of a committee that's going to hear it, because the chairman may appoint somebody to assist the sponsor with additional language. But this is not a process that's really, receptive to a lot of outside influence and people, firing arrows into the dark. So, all of the representatives that have expressed an interest, and there are a few, Representative Bartleman, Representative Edmonds, Representative Woodson, there's a number of representatives that have been curious to look at language, that want to be supportive for our effort. But it's most helpful and most instructive to the process is if we continue to work through the committee chair and the bill sponsor, because that way, the method for introducing amended language is done that way, and it creates the least amount of resistance. The more outside influence there is to this process, the more resistance that it creates, both from the sponsor and from the chair, and that is not supportive to our overall effort. So we're working within those confines, but certainly Representative Edmonds' input, and that's why I shared with contact information for Corinne Mixon with them, because that's the best resource for it. And if there is a diplomatic or way for this to move forward, then it's going to be done with the assistance of the lobbyists and our attorneys. It's not going to be forced onto that process from anybody outside of it. I hope that's helpful. I don't want to, I explained that clearly enough.
Yeah, what I hear is we don't need to be providing language when we call people.
We don't have language to provide, and we won't provide language.
Right.
There is working language, but it's how that gets introduced and shared. I'll tell you why. I mean, I'll just be frank about it. The very worst thing that could happen for acupuncturists at this point is if some rogue language gets put into a draft model of an amendment and just gets introduced into this process. That would really end any dialogue that we have with the chairman or the bill sponsor. And so that needs to be avoided at all costs. We just cannot afford to have that kind of blunder at this point of the process, no matter who wants to help us and for whatever good reasons they want to help us. They too have to be part of that process. And I think that if you were working with any seasoned representative and told them that we still had an open dialogue with the chair of the committee and the bill sponsor, they'd understand exactly what that means. And they'd say, okay, well, if I can be of any more help, let me know. Or if that conversation breaks down, let me know. Because there is a role for other people to introduce language or try to influence the bill. But while it's still in a favorable way that's kind of making its way through the process, we don't want to get too aggressive with how we handle that.
I'm sorry.
I did see a message that I'm glad, I think Galina brought it up, is that, this isn't a standalone piece of legislation. And we see in California, a very similar bill that was introduced in the California legislature. And it's being spearheaded, by the conventional Western allopathic medical community, is that they're really trying to limit options for use of the term physician in particular, and to limit it to people with a Western medical training background. The other option, though, when you read the bill carefully, is that the bill doesn't prohibit use of titles that are otherwise authorized by your Practice Act. The challenge for us in Florida is that we don't really have a well-defined authorization in our Practice Act for titles. Our authorization comes from definitions provided by our board, which is a way to do it. This new law, the new statute, or the new definitions that they want to put in 456 with this bill actually kind of move the goalposts a little bit. They're changing the historical ways that some of, how titling was authorized and, what was permissible. And so what they're saying is that they want it authorized in statute alone. And that's why, we need an amendment so badly, because it provides us some security for our titles until the changes to 456 can be done. And at which point, we wouldn't need necessarily an amendment the way we do now, because we would be in compliance with the requirements under the new law should it pass. Here we go. I'm sorry, I'm looking off to the side just for a second, and it's probably easiest if I just read through the.
All right, I'll let you do it. There's one question and several chats.
Okay, I'm in the chat right now. And so let me see. Yeah, so we got the bill in California. Why was the bill created? I think the bill was created because, legislation gets drafted that way, usually because there's some sort of a national agenda to organize state legislatures to look at an issue in a particular way and see things in a particular way. And then to organize language and under state law to conform with that. And so this may also be moving through other legislatures, but we've seen that language for California, and it's very similar to what we see in Florida. And Dr. Oates, have you or anybody followed up with Representative Edmonds? Okay, yeah. And which other professions are involved? How often do you want us to call, or is email better? This about contacting people, I think if you were to call once a week and maybe email once or twice a week, that's plenty. Like I said, we've been working on this question for several weeks now. And so certainly anybody that's in the healthcare committee arena or people that are in your districts, we're starting to get feedback from our attorneys and from lobbyists that now, any office that they go into, this question comes up. They don't need to, push the issue because we've been ringing the bell pretty loudly up in Tallahassee, and everybody is familiar with why acupuncturists are not happy. Okay, so this is from people on the committees may be friends with people who added language. Wouldn't it be important for any of us making contact if asked to be able to provide exact same language? I hope I answered this question for Anya, if you understand what I'm saying. From a process standpoint, everybody on the committee is not welcome to just bring language. It may seem counterintuitive, but they're not necessarily, it's considered bad form in some ways, and it's not the way they want to see language moved. This is why I've had this question several times in the last week, because we're making more and more progress to bring more and more representatives to our position. And now they want to do something to help us, and we feel like we're not giving them the tools they need to do that. The reason is the only and best thing that they can do for us is to contact Representative Dr. Mazzullo and say, hey, have you considered reviewing the language with the acupuncturists, or to work with the chair of the Health and Human Services Committee. That's the best that we can do. Like I say, presenting raw language that winds up in draft form somewhere is not helpful, because then it sounds like, there's outside influences forcing this question. It may take on a partisan view that is not helpful to our effort. Right now, there's a lot of support to help us, both with the chair and other members of the committee. So, we have to stay within those norms. If we stray from that and we start forcing language from representatives that are not the sponsors of the bill, then instinctively I know that, and I've been told as much, that colleagues are going to circle the wagons around the amendment as is, and they'll pass it as is. Not because they're in favor of the bill, but because they want to support the sponsor. And so this has to be a sponsor-driven effort where there's consensus from Dr. Ralph Mazzullo and the chair of that committee to say, hey, we think this is in the best interest of the bill. We think this is in the best interest of the public. And we think this is the right thing to do moving forward. And that's the way it's going to get done. There is no other way to do that, or in this instance, and it's certainly not at this time. I'm looking here, it says other professions who have not received the amendment, or is the amendment, or it's just acupuncturists. I don't know of anybody else who's asking for an amendment who hasn't received one. It didn't apply to all professions, and not everybody was seeking an amendment. But again, the reason why we need the amendment the way we do is because things are a little bit soft under 457, and we could use protection for our titles, and we need to take it here and now so that it doesn't make it more difficult for us or impossible for us to do it later. So currently, I want to say in the strike all, I saw nurses were taken off the bill, which means they're probably satisfied with the standards under what's authorized in their Practice Act. But I still think we have what's left is chiropractors, podiatrists, dentists, and optometrists. And I apologize if I'm leaving one out, but I think that covers it. I think the audiologists, for hearing were included at one point, but I think in the last version I looked at that, it was dropped. And it's not that they've lost their amendment. It's just that they're satisfied that they have the protections or the authorization that they need in their Practice Act, and they don't need further clarification in Chapter 456 via the bill. Okay, and it says, if our district rep is not in any of these healthcare committees, how can they help us? Is there something we can ask them to do for all of us? Well, I think that's an excellent question, because you're right. There's only, maybe a 15 or so out of 100 plus representatives that are in district. So the answer to the question is, you contact your local representative and say, hi, I'm a constituent. I own a small business in this community. I live in this community. House Bill 583 is designed to provide some new restrictions on how the term physician is used in combination for advertising of my business. If you see the bill come to the floor without an amendment for acupuncture and acupuncturists that support my small business, then I'd ask for your no vote. That's as simple or as complex as it needs to be. You just let them know. Eventually, all of these bills make it through committee. Will have to go for a full floor vote. And so if somebody is serving as your local representative, but they're not on a committee, ultimately they will be called to vote yay or nay on the final version of House Bill 583. And so you just want to, leave it in their ear that this, bill is not well conceived. There are several defects in it. Acupuncturists' titles were not considered when the bill was drafted. We were not given an opportunity to include amendment language to secure our professional titles. And that's harmful to my practice, harmful for my patients, harmful to my business. And, without an amendment, would ask that you vote no. And that's as much as we can ask for. I hope that's helpful. It says, would it help acupuncturists to join together with some of those other professions like chiros, et cetera, to try to get an amendment? I addressed this in a different format another time. And I would say that, collaborating with other, especially physical medicine providers, could be, chiropractors, physical therapists, massage therapists, anybody that's in the physical medicine space. We share a lot in common in terms of our, how we're regulated and when there's pushback against our professions, it usually comes from the same direction. And so on one hand, it makes sense to do that. The challenge with it is, from a practical standpoint, those collaborations tend not to work very well in the long run, because the legislature's designed process, and I use it as what they call like the prosecutor's wedge, is, the first to talk, gets the deal. And so same thing applies here. Oftentimes, if, the first person who moves away from some sort of cooperation or collective effort like that is going to get the best deal from legislators. And usually they're going to break away the biggest and the most powerful first, because they think they have the most to lose. And then everybody else has to scramble on their own. So I would say it's a healthy and intelligent approach to think that, people that have professions that have a lot in common can work together. But ultimately, when given the opportunity to solve your problem with a legislative, stroke of the pen, the person who's probably, most affected and is going to the first to move off of that collaboration is going to get what they want, and everybody else has to, scramble for scraps. It's easy to pick those things apart. So I don't mean to be pessimistic on that. I don't mean to sound negative on that. I wish that those collaborations would hold together more tightly, but it seems like when somebody's interests are at risk, they're going to do what they have to do to protect their profession, their membership, their own piece of pie. And so I guess the final thing I'll say on that is that our lobbyists and attorneys, they share building space with professions that are familiar to us. So, and they have good working relationships with them. And so oftentimes we'll get intelligence from other associations. Sometimes we can get direction on, heads up that something is coming, or direction on how to resolve it. I mean, those relationships historically have been helpful and they have been useful. It's just that it's hard to develop some sort of binding effort that we can all move forward together to sort of steel ourselves against these challenges. We just can't.
David, can you talk a little bit about what's going to be needed to change our Practice Act?
Yeah, I gave an update to Natalia, and Rachel, our editor, had asked me to expand on some of those concepts. I think I'd shared in an earlier post or something that we had on the website that, if FSOMA really needs to ramp up its budget for both for advocacy, but also for modernization of the Acupuncture Practice Act, which hasn't been updated since 1998. And the truth of it is it didn't need to be updated for the most part because it served the public well. We don't have issues with training and, other types of standards of care, things that are articulated are, we're well disciplined. Certainly there's plenty of discipline language in our Practice Act, and, prohibitions on one thing or another. And so the initial version of our Practice Act in 1998 has stood up well to time. The challenge with it now is that like I described before, the goalposts have been moved a little bit. And so we need to expand some of the definitions and authority that's provided in 457 to cover things like titling. And then we can look at other states around the country to see, how has the practice of acupuncture evolved in the last 25 years, and what new language might we need to help codify that in Florida. And there's a short list of things that are obvious that need to be worked on, but opening the Practice Act is no small adventure. And in order to do that, we've sat and got input from the attorneys and from lobbyists. And what it's going to require is expanding our budget from about $50,000 a year for both lobbying and campaign contributions to about $150,000 a year. And everybody's, head spins when I say that, but the truth of it is, we've been told doing this with one lobbyist is near impossible. So we're likely going to require at least one more lobbyist. Right now, the budget for that is $35,000, and we have to move that to about $60,000 in order to cover two lobbyists. The attorney's fees that go along with drafting, both doing the research for creating new statutory language, editing that language, and then putting it in a final draft form. Low estimate of that is probably about $20,000. And some of that money's already been spent this year because we've been looking at that question. And then the real heavy lifting financially is that we need, just like we have Senator Harrell, who's carrying the ball for Senate Bill 230. She's sponsoring that bill. And Dr. Mazzullo in the House is sponsoring the Bill 583. We're going to need a sponsor in both the Senate and in the House. And the campaign contribution for that person is going to be significant because, it's a big investment of time and energy for the representative and the senator and their staff to work with all of the various policymakers, committee chairs. And, it's not as simple as them just getting up and reading the bill and not having to deal with it anymore. They're going to take incoming from any interested profession, any interested party, anybody who wants to weigh in on every comma, conjunction, semicolon, verb that we put in our new statute is going to be scrutinized by other professions. And that's the process. We scrutinized everything we see what they did with the Physical Therapy Practice Act before and after, including dry needling. They had to put up with a lot of input from acupuncturists. We were all over them. Same as it applied to, athletic trainers and following up with their board. Whenever the Practice Act is open, it's going to be interpreted by any and all healthcare providers that feel like they have some interest in that language. And so when you say I have a sponsor for the bill, the sponsor is, yes, the person who's going to introduce it for you, but they're also your chief communicator, coordinator, and defender of that language. So it's a robust budget that comes with campaign, contribution when somebody agrees to sign on as your bill sponsor. And then the sponsors can't get it done alone. So there are other key legislators, whether they're people in either leadership positions or on committee positions that we want to have, I'd say, we want to have an opportunity to educate them, educate their staff, sit with them and explain our position as to why each and every line of whatever that new statute is, and is why it's important and why, all of it is necessary. And so there's additional campaign contributions there. So when you look at the lobbying expense at around 60,000, add in about 20,000 for legal, and that's on the low side, you get to 80,000 quickly. And the balance of 70,000 divided between two big sponsors for your bill and maybe a half a dozen people that are going to be key legislators who are in your corner. In your corner means that they can educate their colleagues, they can carry the ball for us, in that we can't be everywhere all the time. And so you need to have lots of allies and lots of people that just understand why this is important, why acupuncture is as relevant in healthcare today as it is, how many people come to depend on non-pharmacological options to treat not only pain, but lots of internal conditions that we're well known to help support people with. But these are sort of the facts, but in order to move the facts forward requires a lot of, a lot of backbreaking effort, work, and expense to get there. And so FSOMA traditionally budgets $50,000, I'd say around 35 for lobbying and $15,000 for campaign contributions. We don't always have to make that every single year, but we try to budget for it. But we're just, we have to explode the budget in order to achieve a big ask. That's the budget in years when there's no direct legislation affecting acupuncturists. Although we've spent, we've made our original investment for lobbying, and that's blossomed this year because we had to pick up a second lobbyist for the session, as well as pay for additional legal interpretation of the statute, as well as helping draft new language for next year. So it's a process. I answered the question that Natalia had put to me earlier, because there's two places to donate on the website. And one is for the Healthcare Alliance PAC, and the other is for the Legal Defense Fund. And these are distinctly separate things, in that the PAC is specifically for campaign contributions, which are not business tax deductions. So that money goes into the PAC money and it's dispersed or through that fund. And then the Legal Defense Fund is a special fund that FSOMA maintains for legal fees, specifically to defend the profession in instances where lawyers are required. And so we need attorneys to help draft and create language for us. The Legal Defense Fund will be used to help support some of those, that funding. And the PAC is going to be used for providing campaign contributions. That's what the outlook is. And some of that, this discussion is timely now, but we were planning, FSOMA was planning to look at a modernization language for Chapter 457 before we ever heard of these two bills. It needed to be done in areas unrelated to titling, but certainly titling falls under the same area of responsibility.
I
Okay,
put
guys.
links to both the PAC and the Legal Defense Fund in the chat.
Yeah.
And
so
there's
I hope,
options for both for one-time or ongoing contributions.
yeah, I mean, we're going to continue to message this to the membership, and I'm grateful for everybody's participation tonight and their questions. But we need to move this from a group of 20 to a group of 1,250. And, we're just not going to have traction in this issue. And if the money's not there and there's no desire or willingness of the profession to support those changes, then, we can't create it out of nothing. FSOMA can only be as effective as the profession allows us to be in this way. We're trying to just sort of shine a light in that direction and say, we're having this problem for a specific reason. Yes, there's some outside influences, but it also reflects some deficiencies on our own part. And titling wasn't an issue until they want to go ahead and redefine what is the definition of a physician, what is the definition of a doctor, what is the definition of advertising, what is the definition of false and misleading advertising. They're making a lot of changes to some of those definitions, and by doing that, they're expanding the footprint, of like I said, the playing field, and we need to kind of keep pace with that. Otherwise, we fall off the grid. And then it makes it all the more difficult to then reestablish yourself with some of these titling norms and other authorities that are allowed under our statute. So we just don't want to lose any ground, because it's costly and tremendously difficult to gain it back. All of these things were hard fought in the first place, are hard won. I'm looking into the chat and I don't see any more on the Q&A. So I just open it if anybody has a question that they want to share with us quickly before we close. I'm happy to field that now, or you can email me at david@fsoma.org. And, I'm tremendously grateful for all of the support the profession has given FSOMA already. I've literally get dozens and dozens and dozens of messages every day with colleagues and students relaying to us, how their feedback from legislators, their experiences with calling and sharing our message with them. It's very rewarding to see, the profession sort of stand up and try to really, speak for itself in this way in a moment of need. So I'm tremendously grateful for everybody that's doing that. I see lots of feedback on social media. And like I said, I've had many, many, many people contact me directly, too many people to name or count, but I'm grateful to every one of them for sharing their personal stories with me or asking a personal question. And we're just going to continue to take this challenge, to the legislature and fight for what we think is necessary and needed at this time for an amendment to include acupuncturists in House Bill 583. Okay, Ellen?
Okay. Thank you, David.
No, I'm only grateful for the opportunity to share some information. And like I say, I can't cover everything. And if there's something anybody needs clarified, they're more than welcome to email me and, share any thoughts you have, strategy thoughts, anything at all. We'll take help from anybody willing to share it.
Yeah. If you can coordinate through David, though, I've had people.
Yeah, I asked that. I mean,
and
that's the one thing, and I don't want to have to revisit the whole subject I touched on, but everybody has their etiquette, their due process, the way that they want to see things done. And so we don't want to, at this point anyway, since we do have a lot of cooperation and people willing to try to support helping us with an amendment, slow as it may seem, we do have support, and we don't want to, misstep along the way and then force them to have to try to save face in some way that it's actually not in our interest. So we want to do things as sympathetically as we can. If things get any worse, I'll be the first one to send up a flare, and then it'll be all hands on deck. Okay.
All right. Thank you, David, for all your hard work on this.
Thanks, Ellen.
I
Thanks
bet you thought when you stopped being president, it would get easier.
You're right. Right. That's true. That's true. It just gave me extra time for stuff like this, right?
Yeah, yeah. All right, thank you all. We're going to end it now, and
Good
we
night,
will
everybody. Thanks so much.
see you in email land. Thank you.